One of the key thoughts I want to leave you with about this too is that delirium looks worse than dementia because of the point A thing, the diagnoses, that lack of clarity in the present moment. Typically, somebody in a delirium state looks much more impaired than somebody who's in a dementia and is clear in the present moment. I find people get confused about this, and unfortunate ways for the patients, because the delirium states in general are associated with treatable conditions and tend to be acute, and this is what people learn. People tend to equate treatable with less severe. And so I've actually had like arguments with people where they're saying, well, it can't be a delirium because they're so impaired. And I'm saying, actually, one of the reasons I think it's a delirium is because they're so impaired. If it was only dementia, he would actually look better than he does right now.
What I was going to share was, back one of my older brothers has Parkinson's. He had early onset Parkinson's. And he was taking the dopamine, it was synthetic dopamine, for so many years. And after a while, it loses its effectiveness, and you have to raise the drug level so high to treat the Parkinson's that you end up with drug-induced delirium. And what happened to him, that's exactly what happened to him one evening. And his wife took him to the emergency room, and the doctors and nurses just assumed that he was intoxicated and was being treated as such. And apparently they didn't have his history, any record of it, so she really had to convince him, listen, he's got Parkinson's and this is all drug-induced. You cannot treat him for intoxication or some serious psychiatric disorder. But it was really, a terrible thing that happened to him. Luckily, he was treated finally for what he truly was suffering from. In fact, he ended up having the deep thalamus surgery done for Parkinson's at UCLA about 5 years ago.
Did that work?
And it's been marvelous. It's given him a new lease on life.
Parkinson's, in a way, is a particular special case because Parkinson's and schizophrenia are both dopaminergic neurotransmitter disorders, and they're sort of at opposite ends of the same continuum. And so if you're getting medication for schizophrenia and you get too much, or the wrong kind of, you get Parkinsonian symptoms as a side effect. If you're getting Parkinson's treatment and you get too much, you get psychotic.
Well, how do you make a differential between like an access to diagnosis like schizophrenia and delirium?
Well, schizophrenia would also be an axis one, but it would be psychosis.
Or other personality disorders, just in general.
Most cases, you have the other symptoms of a psychosis would be, well, first of all, in most cases, the psychosis would be there from earlier in life if you're talking about older adults. Most psychotic symptoms have their onset in like young adulthood up to about middle age. There are some, but a very small number, of late onset schizophrenic disorders, usually different kind of presentation. But typically, psychotic disorders have more like auditory hallucinations rather than visual, and you have, rather than just being sort of addled and incapable of being in touch with the present moment, you see a lot more delusions, and the thought disorder can also lead to confused conversation. You almost have to like see it to be able to tell the difference. But a lot of it too, like centers on things like thought broadcasting and thought insertion and so forth. So like you think like everybody in the room could hear what I'm thinking right now, or I know that Joan is putting thoughts in my head because that could possibly be my thoughts that I'm having right now. and paranoid kinds of things. Whereas this is usually more, if you've ever seen somebody who is really, really drunk but still conscious, rambling away, or some kinds of hallucinogenic drugs produce states that are not too dissimilar from just how totally scattered and nonsensical. You get this kind of like people will change topics, certainly several times in a paragraph, often once or twice within a sentence. So they'll start off saying something and then they'll finish it in a totally different sentence, and you just can't make any sense at all what they're saying. People are totally out of touch with the environment they're in. So, like one distinction about the clarity of the present moment kind of thing, being in touch with the environment is, if you're interviewing somebody in a nursing home and they think they're in a hospital setting, that's not a bad guess if you've got dementia. I mean, you look at, nursing homes kind of look like hospitals. If you're interviewing somebody in a nursing home and they think they're in a resort hotel, or they think that they're standing with you in a parking lot somewhere, that's more like delirium. Because it makes no sense at all in terms of the actual physical environment.
This reminds me of what you assigned for online for the ageism.
What was it?
What the hell did you do? You were saying about stereotypes of older people, and this reminds me of, like, as far as people that they don't know what's going on around them or something. And that was a problem that when my grandfather, who had emphysema, when he would become very, very dehydrated or something, he'd have to go to the hospital, or if he had fluid in his lungs or something, he'd have to go to the hospital. And if we weren't with him, they thought that he had dementia, they thought that he had a whole bunch of other problems, and it was really that he was so disoriented just from the illness or from new medication or something like that, that it just screwed him up for a little bit. And then after a couple days and being like having the IV and having his meds regulated again, there was not a problem, and they realized that there was nothing wrong with him. But it was something that they just continually stereotyped him as, because he was so old that he was mentally deficient.
It's very, very common that people with delirium are seen as being demented. Just kind of on the theory that anybody who's having a cognitive disturbance and is old probably has dementia. And so, I mean, the most dramatic cures you'll ever see of cognitive impairment are people with delirium that get recognized in time and the underlying reason get treated. We used to occasionally, I hope malnutrition is less common now than it used to be, but back in the early 80s when I was on site units a lot, we used to pretty frequently get people that would come in looking very cognitively impaired and just being in a hospital setting and eating 3 meals a day for a couple of days, a lot of them like that. And it's not always as dramatically different in presentation. I've seen a few people, particularly people who are like on barbiturates, where they kind of damp down some of the, they weren't talking at all, actually. So you didn't really have an opportunity to see any confused speech because they seemed nonverbal and demented. I can remember one case that was brought in by family, and even with, particularly at that time, my optimism about such things, I thought that probably it was a combination of dementia and maybe a delirium from the barbiturates. And they got him off the barbiturates and he totally cleared up. I was a little relieved because he'd been on the barbiturates a long time. On the other side, we had consultation on a family that had moved their mother out from the East Coast, and she had a bipolar diagnosis and had been on lithium for a long time, and they were intent on getting her on lithium, and nobody in California that they saw thought that she was bipolar and needed to be on lithium. They finally found a doctor who prescribed it, GP, actually getting back to the primary care medicine thing, who would prescribe the lithium at their insistence, but who didn't know enough about it to do the regular testing of the blood levels of lithium. And they put her,